This is Dr. Jerry Tennant. In this video I'm going to discuss my theory of the root causes of glaucoma. So I was instrumental in contributed to changes in the way ophthalmology has been practiced during my career in medicine. I developed techniques to safely implant intraocular lenses after cataract surgery, eliminating the disabling thick cataract glasses. I developed better and safer intraocular lenses. I developed the watertight beveled incision to allow immediate ambulation after cataract surgery, eliminating the need for patients to stay in bed for 2 to 3 weeks after cataract surgery. I developed a plastic dome patch to be used after eye surgery to avoid the unnecessary and uncomfortable pressure of standard patches. I developed techniques for saving eyes that hemorrhage during surgery. With the anesthesiologist Monty Hellman, I developed the techniques for safe outpatient eye surgery and opened the first outpatient eye surgery center in Texas. I lobbied Congress to pay for outpatient surgery, resulting in savings of billions of dollars and patients avoiding the hazards of hospitalization, which include falling in strange surroundings, hospital infections, hospital medication errors, etc. Along with Drs. McIntyre and Williamson, I started the Outpatient Ophthalmic Surgery Society to teach ophthalmologists how to safely perform outpatient eye surgery. I trained ophthalmologists around the world to safely perform intraocular lens surgery. This included textbooks about cataract surgery, intraocular lens surgery, and phacoemulsification. I did the majority of the FDA studies for the Vissix laser for use in refractive surgery. With Dr. John Corboy and Dr. Malcolm Ng, I was the catalyst for forming the Royal Hawaiian Eye Meeting, which has become the third largest eye meeting in the world. I developed new theories explaining that acupuncture meridians are actually stacks of rechargeable muscle batteries, forming a power supply for every organ in the body. I found that the power supply to the macula is the stomach acupuncture meridian. I found that the power supply to the optic nerve and retina is the liver acupuncture meridian. I found that the power supply to the drainage system of the eye is the sympathetic acupuncture meridian. So, what is glaucoma? The following is a text from the American Academy of Ophthalmology. Glaucoma is a disease that damages your eye's optic nerve. It usually happens when fluid builds up in the front part of your eye. That extra fluid increases the pressure in your eye, damaging the optic nerve. Primary open glaucoma. This is the most common type of glaucoma. It happens gradually where the eye does not drain fluid as well as it should, like a clogged drain, and as a result, eye pressures build and starts to damage the optic nerve. This type of glaucoma is painless and causes no vision changes at first. Some people can have optic nerves that are sensitive to normal eye pressure. This means that their risk of getting glaucoma is higher than normal. Regular eye exams are important to find early signs of damage to their optic nerve. End of quote. Note, Dr. Tennant does not believe that there is such a thing as normal pressure or low pressure glaucoma. This will be explained later. So, again, what is glaucoma?
In the healthy eye, fluid called aqueous humor is made in the front of the eye and flows out through a tiny drain called the trabecular meshwork. The trabecular meshwork is located in an area called the drainage angle. If fluid doesn't flow out of the drainage angle properly, eye pressure increases and damages the optic nerve.
So let's take a look at our theory of the root cause of glaucoma. Now remember that the American Academy of Ophthalmology and most medical societies state that the cause of high eye pressure is unknown. I'm going to present in this video a theory of the cause of glaucoma with the hope that others will prove or disprove my theories. No official organization has studied my theory to prove or disprove it. To support or dispute my theories, I routinely use objective scientific tests to indicate whether glaucoma's progressive loss of vision can be influenced. The tests include the following. The vision is tested with a standard Snellen chart, acuities using the best available glasses prescription both before and after therapies. OCT, or optical coherence tomography, is a non-invasive diagnostic technique that renders an in vivo cross-sectional view of the retina. OCT utilizes a concept known as interferometry to create a cross-sectional map of the retina that is accurate to within at least 10 to 15 microns. So basically you can think of the OCT as very much like an MRI. If you go get an MRI of your brain or some other organ, you can see it in cross-section. And certainly with this, instead of using radiation, it uses a laser, but we get a cross-sectional image. The OCTA is images of the blood vessels at the different layers of the retina. Each different layer of the retina has its own blood vessel layer, and as you can see in this image, we can map out each of these. This is particularly helpful in wet macular degeneration. Tests of whether glaucoma can be influenced includes electroretinogram. This tests the function of the visual system from in front of the eye, through the eye and retina, through the optic nerve to the back of the brain, the occipital lobe, and then to the front of the brain, the frontal lobes. These are objective tests that give scientific validation of whether glaucoma has been influenced in each and every patient. These tests are performed by an independent technician and placed in the patient's record before seeing me. Since the optic nerve cells are replaced every 8 months, patients with glaucoma are examined. Treatment at home can be recommended and then re-examined with the same tests a few months later. The tests are then shown to the patient so that each patient can personally review the results and make a personal decision about whether to continue the recommended therapies at home or not. The results are also available to the patient's personal physicians upon the patient's request. So let's take a closer look at my theory of glaucoma. My theory of glaucoma, like many other illnesses, is based on the fact that the body is constantly wearing itself out. Cells must be replaced in the macula every 48 hours. The lining of the gut is replaced every 3 days. The skin you're sitting in today is about 6 weeks old, your liver is 8 weeks old, and your nervous system is about 8 months old. There are some variations in these times, slight variations in different reports. However, the differences are slight. So what we realize is that chronic disease only occurs when we lose the ability to make new cells that work. Let me say that once again. Chronic disease only occurs when we lose the ability to make new cells that work. So that leads us to the obvious question, well, what does it take to make a new cell that work? Well, cells run at minus 25 millivolts, but it requires minus 50 millivolts to make new cells. Some people get confused because if you take a cell in a petri dish and put an electrode inside the cell and one outside the cell membrane and measure across the cell membrane, you get somewhere around minus 90 millivolts. However, the environment of cells is minus 25 millivolts. We need all the materials that are necessary to make new cells. This is called nutrition and requires a functional digestive system, including stomach acid. We must deal with any toxins that destroy cells as fast as we make them. The most common toxins are heavy metals like mercury, dental toxins, and GMO foods with the pesticide called Roundup or glyphosate. Now, we need to understand the body's voltage and wiring system. The body has 5 different battery packs. Our muscles are piezoelectric rechargeable battery packs, and the fascia around our muscles serves as the body's wiring system. Our cell membranes are small batteries called capacitors, and water just inside the cell membrane called exclusion zone water is H3O2, which is an electron donor form of water. Inside the mitochondria, we have a rechargeable battery system. When the battery is charged up, it's called ATP, and when it's discharged, it's called ADP. And our DNA has its own battery using scalar energy. This diagram was sent to me by Dr. Jera Altubiak, which I think clearly shows these battery packs. You can see the muscle battery packs that go up and then run through specific teeth. From there they go to the cell membrane capacitor, and then there's the exclusion zone water just underneath the cell membrane. And then we have the mitochondria, and finally the DNA. Now, our muscles are rechargeable batteries that are stacked one on top of each other like stacking batteries in a flashlight to form a battery pack. Each organ has its own battery pack. And so the stack of muscle batteries is what's been called an acupuncture meridian, and the example that we're showing in this video is the liver meridian. The liver meridian, as you can see, goes from the feet up to the brain. It starts underneath the big toe, goes up the back of the leg, goes up around the knee, up the inside of the legs, and goes to the muscle that holds the low back together. It goes up and goes around the hooks into the muscles in the area where we sit. Goes around the diaphragm, around the heart and lungs, and finally up into the neck. And as it goes into the neck, it makes a loop, and eventually is the power supply to the optic nerve and retina. From there it goes to the midbrain, and finally it hooks into the gallbladder circuit, which then goes back down through the body in a downward fashion. So remember that the power supply to the optic nerve and retina is the liver meridian. In every case of glaucoma we have examined, and since developing this theory, the liver meridian on one or both sides of the body have lost their voltage and cannot supply the necessary voltage to replace cells in the optic nerve and retina as they wear out or get damaged. The result is a loss of functional cells in the retina and optic nerve that we call glaucoma. As the cells in the optic nerve die and are not replaced, the optic nerve becomes pale in color and develops a depression in the center called cupping. This can be accurately measured with the OCT device and compared from exam to exam. As the nerve fibers from the retina that extend into the optic nerve die, they leave a blind spot in your field of vision. However, since they don't involve the macula, you can still read just fine until the very end. The field of vision can be mapped as a measurement of whether you have glaucoma and whether it is getting worse, stable, or getting better. However, visual field testing is laborious and often not reproducible. Here are examples of the field of vision tests that are typical of glaucoma. One can, however, follow glaucoma's progression with the OCT test, and many eye physicians feel that following the OCT is more reliable since it is not dependent upon patients' response time and patients' ability to look straight ahead at a specific spot for a long period of time. But we actually do both tests, the visual field and the OCT. So there are several things that contribute to glaucoma, which is loss of retinal and optic nerve fibers, loss of power in the liver circuit so that minus 50 millivolts is not available to repair the retina and optic nerve as it wears out every 8 months or is damaged, appears to be the primary driving factor in glaucoma. Low blood pressure, so there's inadequate blood pressure to get up to the brain and optic nerve and retina. This has become more of a problem since general and internal medicine physicians have been taught to lower the patient's blood pressure more and more and more so that there is inadequate pressure to get from the heart up into the head, including the eye. Lack of nitric oxide. Everyone past the age of 40 is deficient in nitric oxide, and nitric oxide controls circulation, which involves dilation of the capillaries. Taking statin drugs to lower cholesterol is a problem. All nerve cells are 50% cholesterol by weight, so if you don't have adequate amounts of cholesterol, you can't keep your nervous system, including your optic nerve and retina, repaired. Increased eye pressure due to poor drainage from the lymphatics, which are under the control of the sympathetic power supply and thus affected by our emotional baggage. So again, we see that the eye, even though it's quite small, has 3 separate power supplies. The power supply to the optic nerve, which replaces itself every 8 months, is the liver circuit. The power supply to the macula is the stomach circuit. The power supply to the control mechanism for pressure in the eye is the sympathetic system, which controls the lymphatics. So my theory of glaucoma begins with the loss of voltage in the liver circuit, or liver acupuncture meridian. So that leads us to the question, well, why won't the liver circuit hold a charge? And we have identified 5 different things that can affect voltage in any circuit. Lack of adequate thyroid hormone, scars which block the voltage in a circuit, dental infections because an infection in a tooth acts like a resistor as voltage flows through the tooth, emotions, and finally toxins. So let's take a look at those. Hypothyroidism. Thyroid hormone is extremely important because the thyroid hormone T3 controls the voltage of every cell membrane in the body. It also controls the total number of mitochondria in the body. So the amount of T3 that the person has is critical. Now, the thyroid hormone T2 controls function of the mitochondria, but is largely ignored by most physicians. Now, the whole thyroid process begins in the hypothalamus up the brain, which is under control of adrenaline. And by the way, the adrenals are under control of the spleen acupuncture circuit. So the hypothalamus makes thyroid or thyrotropic releasing hormone, which tells the pituitary to make TSH, which tells the thyroid to make T4, which then has to be converted to the active form of T3 using iodine, selenium, zinc, iron, cortisol, progesterone, and glutathione. If you are missing one of those cofactors, then you have a tendency to make a fake hormone called reverse T3, which is sort of like a key that fits in the keyhole but won't turn the tumblers. Docs are trained to look at TSH and occasionally the T4, and if they tell you that these are normal, then they assume that your thyroid's functioning normally. But as you can see, you can have a normal TSH and even a normal T4, but if you can't convert it to the active form of T3, you can be 80% deficient at the cell membrane level with normal blood tests for TSH and T4. Now the reality is that TSH actually stimulates the production of a substance called sodium iodine symporter, or NIS, which then extracts iodine from the blood and carries it into the thyroid, so the thyroid can make T4. So in people who are deficient in iodine, sometimes as you begin to correct the iodine levels, the TSH level will actually go up so you can make more NIS to carry the additional iodine into the thyroid. Now let's look at scars. Remember that the fascia, which is that shiny substance around muscles, is the body's wiring system. Fascia is actually a semiconductor, and a semiconductor is a collection of molecules designed in such a way that they carry electrons at the speed of light, but only in one direction. So if you put a scar across the fascia, it causes fraying of the ends and actually blocks the ability of electrons to flow through the fascia and thus blocks the voltage in that power supply. So the scars that don't actually touch the fascia don't seem to matter much. One can look at specific examples in different organ systems. So for example, many of the common scars that we see in people are in the stomach circuit. In this case, you see that these scars are on the knee, on the breast, C-sections, and appendectomies. But scars across any of the acupuncture power supplies can drop the voltage in that circuit. Scars can be corrected with essential oil blend called soreness and the use of the scalar energy from the biotransducer, which will reassemble these molecules in such a way that they'll again carry voltage. Dental infections. Recall that each acupuncture power supply goes through very specific teeth. In the liver circuit, are these teeth in red, which you can see are both upper and lower canine teeth. Now, if you consider that there's a circuit going through this tooth in the upper left image, you can see how decay would act like a resistor and drop the voltage as it tries to pass through this tooth. And if the decay gets worse, it's a bigger resistor and drops the voltage even more. Finally, a root canal procedure blocks the circuit almost completely and acts like a circuit breaker.
Step-by-step look at a modern root canal procedure. Here is a healthy tooth. Inside the tooth, under the white enamel, is a hard tissue called dentin. Inside the dentin is a soft tissue called pulp. The pulp contains the tooth's nerves and blood vessels. It extends from the crown of the tooth into the roots of your teeth. If the pulp becomes inflamed or infected, your endodontist will remove it, relieving your pain or discomfort. Here's how root canal treatment works. First, your endodontist will numb the tooth so that you won't feel anything during the procedure. A small shield isolates the tooth, keeping it dry and clean. An opening is made through the crown of the tooth and into the pulp chamber. Fluid is put in the canals to kill any bacteria and help rinse out debris. Then, the pulp is removed. Using small instruments, the endodontist carefully cleans and shapes the canals. After the space is cleaned and shaped, the endodontist fills and seals the root canals. In most cases, a temporary filling is placed to close the opening until you see your dentist. After your endodontist is finished, you must return to your dentist to have your tooth properly restored with a filling or crown.
So the dentists are the only physicians that think you can get away with leaving dead tissue in the body. No other doctor really believes that. Many people feel that Boyd Haley at the University of Kentucky was the world's preeminent human toxicologist, and Dr. Haley has shown that one root canal shuts down 63% of your immune system. So in addition to blocking the voltage in that particular power supply, it puts out toxins that damage your immune system. Now, in the upper left corner, you see where a root canal has been pulled, and you see all the infection in the bone. Having infection in the bone is very much like sticking a screwdriver in a wall socket. It shorts out the circuit and flips a circuit breaker. And so it is with a root canal. Once the infection finally goes through the tooth and out into the bone around the tooth, no matter how many times you turn the circuit breaker back on, it keeps flipping back off. And so it is with infection in bone around a tooth. And unless this is cleaned up, then you can never get that power supply to stay turned back on. Another problem is when you have a tooth pulled and the dentist leaves the ligament behind that normally holds the tooth to the bone. This ligament interferes with the bone healing, and you end up with a chronic abscess in the bone. This also acts like a circuit breaker, and these can be in the bone for 40 or 50 years and not cause pain, but they short out the circuit. Next, let's look at emotions. Emotions are stored in the body as magnetic fields, much like a DVD writer. In the left image, you see a magnetic needle that writes images on that platter of the DVD. And images and emotions are stored in the body much the same way. So, different researchers have identified which emotions are stored in which circuits. But to understand how we can influence this, you must understand that every different circuit runs at a different frequency, very much like different radio stations. And every different emotion has a different frequency, and they tend to resonate with each other. For that reason, anger gets stored in the liver gallbladder circuit, fear gets stored in the kidney bladder circuit, worry gets stored in the spleen stomach circuit, lack of joy in the heart small intestine circuit, grief in the lung large intestine circuit, anxiety in the sympathetic parasympathetic, and finally these emotions began to block these various circuits. Now, to really understand how we can influence this, you have to think about an orchestra. If all the instruments are in tune, then the orchestra plays beautiful music. However, if one of the violins is out of tune, that's what you hear screeching at you. On the other hand, if you look at memories, they are stored in the body at frequencies that are in tune with the body, whereas emotions are stored in frequencies that are like the out-of-tune violin. Now, in this image, you'll see that the human body is an electromagnet, and every electromagnet is surrounded by a magnetic field, and in the human it goes out about 5 feet or so. So everything that goes on inside the body is electronically duplicated or represented out in the magnetic field around the body. So if you go moving through this magnetic field and there are only memories there, then you move smoothly through the field. However, if you bump into an area that represents an emotion in the body, it's a bit like walking down the sidewalk and all of a sudden you feel a gust of wind hit you in the face. So you begin to bump into this resistance which represents the emotion. Now, the important thing is to understand that both emotions and memories are frequencies, and because they are frequencies, they can be tuned with scalar energy. So if you simply apply scalar energy, which is either sound or the biotransducer, to the emotion, that will simply tune it into being just a memory. So again, what we've done is we've tuned an emotion into being just a memory. So let's say, for example, you are driving around a curve and you have a car wreck. The next time you drive around the curve, your body responds to that emotion of the wreck, and you perspire, your pulse speeds up, etc. Now, if you tune the emotion of the wreck into being just a memory, then the next time you drive around the curve, you say, oh, this is where I had my wreck, but nothing else happens, you see. So tuning emotions into just memories is a very powerful way of doing this. So Dr. Marshall on my staff and I have combined the concepts of healing as voltage, scalar energy, biofield tuning, biogeometry, emotion code, and neurotherapy into a system we call the Tennant Marshall Scalar Emotional Tuning. Now we need to look at toxins. All toxins are electron stealers and must be addressed in order to restore voltage to the liver circuit. So we have the ability to address toxins, and that subject is beyond the scope of this glaucoma lecture. However, what you must remember is that anytime you take a rechargeable battery and you drain it all the way to zero, it flips its polarity upside down, and then nothing you do really works. So what you see in this image is that we have a fully charged battery on the left, and then some combination of not enough thyroid hormone, scars across the circuit, dental infections in the circuit, emotional baggage, and toxins finally add up to enough to drain the battery to zero, which flips it upside down, and this causes the loss of having the 50 millivolts that you need to make new cells, and thus you end up with an organ system that doesn't work, and in this case it's the optic nerve and retina. Now let's take a moment and talk about so-called normal pressure or low pressure glaucoma. So again, the concepts about this definition of glaucoma is that glaucoma is a family of multifactorial optical neuropathies characterized by loss of retinal ganglion cells, leading to typical optic nerve head damage and distinctive visual field defects. Although the pathogenesis of the disease is unknown, it is well established that the main risk factor for glaucoma is elevated intraocular pressure. Reducing intraocular pressure is effective in slowing down the progression of the disease, but some patients still progress despite adequately controlled intraocular pressure. And this quote comes from Ocular Perfusion Pressure and Ocular Blood Flow in Glaucoma, Current Opinion of Pharmacology, etc. Well, obviously I disagree with this basic theory that is generally taught in ophthalmology. So what is a normal eye pressure? Well, normal eye pressure is considered to be from 12 to 22. However, we do see changes in the visual field and optic nerve death with these normal pressures. And a great discussion of this problem is in this paper, Low Tension Glaucoma, an Oxymoron in Ophthalmology. And I suggest anyone interested in this subject to read this paper, because these changes in visual field and optic nerve death with normal pressures continues to baffle eye surgeons. I believe that my theory explains all of this, because so-called normal pressure or low pressure glaucoma is a result of the optic nerve wearing out and having to be replaced about every 8 months, but that the replacement is dependent upon having minus 50 millivolts available from the liver gallbladder muscle battery pack and having enough cholesterol to make new neurons. This theory explains why patients often continue to lose function no matter how low you get the pressure. It also explains how you can see the perineural thickness increase in the OCTs of patients after you correct the reasons that the liver gallbladder circuit has lost its charge. It also suggests that studies should be done considering the ability of statin drugs to block making new neurons by preventing the availability of the liver to make adequate cholesterol for neuron creation and function. Current ophthalmic standard of practice does not include correcting nitric oxide levels, in spite of the fact that there are more than 100,000 articles published in standard medical literature about the importance of nitric oxide. Now, making new cells also requires the nutritional piece. Cells need vitamins and minerals, and this is under control of fulvic acid. Cells need oxygen. Delivery of oxygen is under control of nitric oxide. Cells need electron donor water. Cells can be damaged or destroyed by toxins. And you need all of the nutrients that it takes to make new cells, and you need them all at the same time. So we've developed a nutritional program that contains all the things that we can identify that it takes to make new cells and to make them work correctly. So what to expect if you were to have us evaluate your glaucoma? We evaluate the function of your retinas and optic nerves by looking at both the physiology, visual acuity and electroretinograms, and the anatomy. If there is too much scarring, we don't recommend therapy. We measure the liver circuit and determine why it won't hold a charge. We then, as you can see, we look at the physiology, the acuity, and the anatomy. We correct the polarities and recharge the muscle battery packs with the Tennant biotransducer and the Tennant biomodulator. We may support oxygen levels with hyperbaric oxygen and or live O2 or exercise with oxygen therapy if the patient is local. One or a few hyperbaric sessions aren't useful since the half-life of hyperbaric is 24 hours. We put voltage directly into the eye with a biotransducer. We supply nutrition to make new cells and to restore nitric oxide levels. Often there is enough damage in the retina optic nerve that improved vision is not possible. However, stopping the vision from getting worse is a worthwhile goal and often the only reasonable expectation. Remember that nothing can overcome a dental infection in the liver circuit. Such an infection is like a screwdriver in the wall socket. It will keep flipping the circuit breaker until the screwdriver is removed. A dental infection will also keep flipping the liver circuit breaker until the infected tooth in the bone is corrected with ozone and platelet-rich fibrin. It is uncommon to find root canals and or other dental infections in the liver gallbladder circuit teeth. Remember that emotions are stored with specific frequencies in specific circuits, and anger is the emotion most often found blocking the liver circuit and thus influencing glaucoma. So I don't claim that I can cure glaucoma. I have presented theories that have not been fully evaluated by traditional studies. My efforts are simply to return the body to normal physiology and let the body attempt to heal itself. I only provide before and after scientific exams and allow them to speak for themselves and make no other claims.